Welcome to Skin Deep here on Sirius XM Radio Channel 141 HUR Voices. I'm your host, Sharon Morton, and we're doing part 2 of last week's show on erectile dysfunction. As we mentioned last week, as many as 52% of men experience erectile dysfunction, with it affecting almost 40% of men age 40 and 70% of men age 70. Men who have heart disease, diabetes, and are taking certain medications sometimes have higher risks of experiencing erectile dysfunction, and Viagra isn't always the cure for everyone. We need to be talking more about this, folks, because ED is breaking up some marriages and relationships, and we just don't want that. Back in the studio with me for part 2 of the show is our doctor on duty, Dr. Wanda Dyson, founder of Change for Life Wellness and Aesthetics. She's also the author of How to Be Healthy, It's Not What You Think. Visit her website at cflwellness.com. We also have on the phone Dr. Ron Rothenberg. He's a pioneer in the field of preventive and regenerative medicine and the founder of the California Health Span Institute, which is committed to transforming our understanding of and finding treatments to manage aging. Dr. Rothenberg is also the author of Hormonal Bioidentity, Keeping Your Patient Happy, Healthy, and Sexually Alive. And we have last week's guest from our listening audience on the phone, Will, or some of us call him Bill. He's a 51-year-old male that we invited on the show to offer his perspective on getting some questions asked that he and other men have about erectile dysfunction. This show is part 2 of last week's show on erectile dysfunction. We're talking about it here on Skin Deep because everyone is keeping it on the down low, and it's breaking up marriages and relationships. No one wants to talk about it, but we are here to talk as much about it as possible. We have 2 experts one in the studio and one on the phone, and we also have a member of our audience who has questions. Dr. Wanda Dyson, Dr. Ron Rothenberg, and Will, let's pick up where we left off last week. So where did we leave off, by the way?
So Will was saying that his sexual activity was falling off and that he wasn't putting out as much as before. And I just wanted Will to clarify what he means by putting out. Does he not have as many erections? Does he not get aroused as often as before? Can he not perform as long as he did before when he was younger?
And should he take Viagra?
And what does that mean to Dr. Rothenberg in terms of possibilities of what's going on with him?
So, Will, you want to answer those questions that Dr. Dyson had?
Certainly, Dr. Dyson, I putting out is just an old term we use. I guess it's applied to my marriage would be frequency. Once we get into the act, we're good to go. But being as the leader in our sexual relationship, for me, the interest is just not what it used to be, and my wife is not the aggressor. So just getting into the act of sex itself
is not a frequency. Is that normal for an older guy, an older person in their 50s? Is that normal to not want it as frequently?
Well, there's two components that are related but really different. One is libido, that's horniness, that's desire for sex, and one is erection function. So they're not necessarily linked.
Okay.
So before Will asked about like porn addiction and things like that, well, I guess if someone had that, libido in normal relationships might be less because the guy's kind of addicted to porn. But again, that's a separate concept from erection function. You can have one without the other. So I just wanted to clarify that point.
Okay.
So is it normal that libido goes down as you get older? Well, one of the major determinants of libido is testosterone level. And we talked a little bit about that last time,
right.
Especially the concept that just having a, quote, normal lab test being in the reference range doesn't mean you're optimal.
Okay, what is optimal, Dr. Rothenberg? I'm sorry to interrupt. What is optimal? What number or what range is optimal?
Okay, well, again, it's not engineering where you have to hit an exact number. And there's different ways of measuring testosterone. There's total, free, bioavailable, etc. So certainly in the upper quartile of the reference range. So say the reference range is 300 to 1,000, so in the upper quarter. But this type of medicine is clinical. A guy starts out low, you treat him with this or that in terms of libido now. Now we're talking about this, not PD5 inhibitors like Viagra. And he says, oh, things are great now. Okay, we're going more on clinical response than trying to hit an indefinite number.
I was going to ask you too, Dr. Dyson. So Viagra doesn't address libido. It only addresses ED, right? Is that right?
I'll let Dr. Rothenberg answer, but
Okay.
going back to the testosterone issue, Dr. Rothenberg, can you address how you treat that in layman's terms? So I know that it's possible that you would use actual testosterone. You may also use HCG. You might use other therapies. There might even be nutritional supplements that might elevate testosterone. So can you kind of go into that for a person such as Will on the phone and what you would do?
So the first part, PD5 inhibitors, Viagra family, they of course, they work on, as I call it, plumbing. But could that affect libido? Well, it could in a way that the guy's got more confidence that, things are going to work right. So, and then, so indirectly it could. Okay. Now, basically, with the nuts and bolts approach, if testosterone is low, and there's different lifestyle, more resistance exercise that can, that can help. There's certain herbal supplements, that cause like tribulus terrestris, which could help. Notice I say could. You really want to make a change the practical way. If the guy needs testosterone isn't optimal to treat with testosterone.
Okay.
That's the simple-minded approach to it.
But if you treat with testosterone, there might be other issues that might occur, like testicular atrophy and things of that nature. So.
Right. There's possible side effects. And, atrophy sounds so final. One of them was, I describe it, using the right kind of dose, not an abuse dose, would be loss of testicle volume and decrease in sperm count as a side effect of testosterone.
Oh.
So, there are ways to get around both of those. You mentioned HCG, that's the hormone that the placenta makes in pregnancy, but when used in guys, if the cells that make testosterone, the Leydig cells, still work, then that can stimulate his own production of testosterone.
Without
the joke is he'll have a positive pregnancy test.
But he won't have the testicular, the shrinking of his testes and things like that if he uses HCG to raise his testosterone.
Okay.
Well,
all right.
You're right. The shrinking of the testes, which again can be a little or a lot, like everything, and won't have the decrease in sperm count.
So he has to find a doctor that knows that these are some of the things that he can do.
Oh, certainly.
Because a lot of doctors that practice, Western medicine, they don't always, advise what you and Dr. Dyson are talking about in terms of HCG and what else were you saying? Giving testosterone to the patient.
He uses actual testosterone. But Dr. Rothenberg, aren't a lot of doctors now afraid to use testosterone because they think it's going to cause a stroke?
Yeah, but unfortunately, they're 100% wrong if they believe that. There's a study by Sharma on 80,000 VA patients, low testosterone treated, raised. The all-cause mortality rate decreased 50%. Half the chance of dying.
Interesting.
From cardiovascular disease, from cancer, and less prostate cancer as well.
Okay.
So there's a lot of myths about testosterone that turned out to be myths that were never true.
Where are those myths coming from?
Well, it comes from one case report in 1941 by Huggins, and that was a man treated with testosterone that caused prostate cancer to accelerate. And the way they determined that was by a blood test.
Okay.
That's it.
Wow.
Heavy research since then. Where does the heart business come from? There were a few published studies claiming testosterone increased certain cardiovascular risk in serious medical journals. But if you look at their numbers, they didn't. Their own numbers in the study, such as the vegan study, did not justify their conclusion. For example, on testosterone, 20% death rate, or off testosterone, 20 on 10. Every single metric was better. So there were some misleading, wrong articles, and then eventually the journal publishes a clarification on their website months later. But no one ever reads that.
Yeah.
So anyway,
okay.
So cardiovascular safety has been quite established.
All right. Will, does that answer any of your questions at all? I mean, does
that does.
Okay.
He spoke on a couple common issues. I have issues about some common behaviors, such as alcohol. If I can ask, if I can present it out there.
Go ahead.
I know a lot of times, especially, I don't drink anymore. When I was younger, definitely used to drink liquor. And a lot of guys, my peers, would drink dark liquors or what we call clear liquors like gin or or vodka, and we felt that the vodka would give you more virility, and the brown liquor would kind of put you to sleep. At this age, we'll drink wine or champagne or something like that. Is all alcohol working against a man of my age?
There's one active drug in all alcohol drinks. Alcohol.
Okay. Alcohol.
So it's not.
And is that working against? Is that working
drug
against?
In wine, in bourbon, in tequila, in vodka. It's different amounts. And there's the line from Shakespeare, from Henry V. Falstaff is saying, "But alcohol adds to the desire, but takes away from the performance."
I was going to say, alcohol seems to add to a man's libido. Like it makes them,
Right.
It makes them hornier. But yeah,
that's the Shakespeare line, adds to desire.
Right.
Removes inhibition.
Okay, so your question was, should you stop wine? And I mean, is that what you're asking? Will?
Yeah, yeah. So at my age now, I'm finding out a lot of guys that drink Cavassier and some of those darker alcohols are having problems with their condition. Well, back in the day, we used to say that the vodkas and the gins used to help us. So I'm just wondering.
No, I don't. It doesn't matter what alcohol is. Alcohol.
That's
all
just
that
a
is
myth.
Kind of what your belief system on it. But
okay,
it's one drug.
So, Dr. Rothenberg, does it help or hurt?
Right, stay away or.
Well,
It sounds like it
quality
hurts.
of life with a glass of wine. Well, not necessarily. With a glass of wine or a beer or a little drink.
In moderation, right?
Function.
Moderation,
Yeah.
like everything else.
And the guys should know. I mean, everyone's working in an individual way,
Okay,
If it's take away from performance and it's not worth it, just don't do it.
I have a question. It's really hard for women to tell a man that his erection isn't up to par. And a lot of men, they stay silent or pretend like nothing is wrong. Do they know that I know they know when they have an ED, but do they know when their erection is not as like it used to be? Do they know that? And should a woman?
The term ED is a spectrum.
No, you're right. You're
all
right.
or none.
Okay. So does a man know, Dr. Rothenberg, is what I'm trying to find out. Should a woman, because they do know when it's not like it used to be? Because a woman is sitting there trying
I'm speaking as a man here more than as a doctor, but I've seen, thousands of patients. The answer to your question is yes, men know.
Okay.
They
pretend, some of them, I was going to say some of them remain silent. So what should a woman do, without hurting their feelings? Because a lot of times that's tied to their whole, what is it? Ego, yes. Thank you, Dr. Dyson. And I have to, wait a minute, we have to answer this question. Dr. Rothenberg, we have to continue this on the other side of the break, but I do want to get that answer, okay, if that's okay. Okay. We'll be right back after these messages here on Skin Deep. I used to think new year, new me. Yeah, right. More like new year, new wrinkles. With every passing year, we all look older. But now that all has changed, thanks to this magic in a bottle, Plexiderm Rapid Reduction Serum, it's like I turned back the clock instead of ringing in another new year. Plexiderm is a clinically studied serum that visibly eliminates your wrinkles, crow's feet, and under eye bags in minutes. It's the easiest New Year's resolution I've ever made. All I had to do was apply this powerful serum to my problem areas, and within 10 minutes, I was a new me. And the best part is, there's no surgery. It's all natural. Ring in 2020 with confidence, knowing Plexiderm is going to give you smooth, younger-looking skin in minutes. The best part is, it goes on clear, so nobody ever knows I'm using it. Leave your under-eye bags and the wrinkles in 2019 with Plexiderm. Bye-bye bags and wrinkles. Hello to a new me. Go to tryplexiderm.com and use my code SKIN, S-K-I-N, for 50% off plus an additional $10 off. That's right, 50% off plus an extra $10 off. This offer is also available by calling 1-800-685-1292 and mentioning my code SKIN, S-K-I-N. That's S-K-I-N. Plexiderm is backed by a 30-day money-back guarantee. Visit tryplexiderm.com today and use my code SKIN at checkout. Are you a business owner looking to double or triple your profits? Look no further. Go to MortonMediaTV.com/call and speak to our media experts on how to gain up to 100 new customers every month. Get your business and your message in front of millions of people through TV and radio. It's easier than you think, and it's free. Want your business showcased on major TV networks and radio stations? Want to see a rapid increase in your profits? Speak to our media experts today and let them show you how to bring in hundreds of new customers for your business. Even if you've never been on TV and radio before, we can help you get the exposure you need to grow your business and your profits. You have nothing to lose because it's all free. Go to MortonMediaTV.com/call. That's MortonMediaTV.com/call.
Do you need expert advice from successful business leaders on how to start, grow, and finance your business? Tune in every week to the Small Business Report at HUR Voices on Sirius XM Channel 141 with your hosts Carl Brown and Sharon Morton. The Small Business Report gives you, the small business owner, and those thinking about starting a business, expert advice from successful business leaders around the country. Visit us at smallbusinessreport.biz and like us on Facebook. The Small Business Report, giving you the tools you need to succeed.
And we're back here on Skin Deep. I'm your host, Sharon Morton. We're having part 2 of an informative and very important discussion about erectile dysfunction. So I was asking you, Dr. Rothenberg, do men realize when their erections are not like they used to be? And you said yes, but a lot of times men don't say anything. What is a woman supposed to do or say? Because she doesn't want to hurt his feelings.
It's, right. It's a delicate balance. Joking she could slip some Viagra in his grape juice and see what happens.
We're not.
I'm kidding.
You just say, yeah, please say you're kidding on that, doctor.
I am.
Okay. What should she do? Seriously.
By the way, dear, you could be a little harder. I don't, maybe, in this modern era, there's all kinds of things we can do.
Okay, no, Dr.
Rothenberg.
Rothenberg. You can't say that, Dr. Rothenberg. That will hurt their feelings. They're already experiencing some issues. What do you say, Dr. Dyson?
I don't know how you can do it without hurting someone's feelings.
There's no way to tell your partner that they need some help, or which. Dr. Dyson, help me, please.
Delicately, I don't know. That's hard. My partner doesn't have that problem.
But guys don't react to that.
Oh, that's so unfair, Dr. Dyson. That's so unfair.
And her partner's sitting here in the studio.
That's so unfair.
Okay, so no one has any kind of help or information for all the women out there. No suggestions or recommendations for all the women out there who want to talk to their partner. This is part of the problem. Everybody's keeping it silent. We need to talk about it.
I had a very difficult time getting any man who has the actual issue to come on the show and talk about it.
Well, as long as people aren't talking about it, it's going to continue to be a problem. And let me tell you, a lot of women are they might start looking elsewhere if they can't address the issue with their partner. Do you know what I'm saying? A lot of marriages, we don't want any marriages to break up or relationships to break up. We need to be able to help our partners with, this problem, ED, and help them with their self-esteem at the same time. How is that doable?
Sharon, I think that's a two-sided conversation, right? And here I am talking as a man, right? I know that the whole process is an interactive process. A lot of times men are looked upon to lead the whole process off. So if you've been in a marriage for 21 years or so, and, everybody's body image has changed, and a lot of men's guts start falling out, and so do their women. At that point, if it's up to the guy to just bring it, and the woman to receive it with all her, glory, then there's no hands-on, there's no oral, there's no other issues going on to help this process to bring some excitement into it. Then, guys kind of been around the curve. They've been with that woman and that woman over the 20, 35 years, and it's almost, it's not super exciting. So it has to be an interactive process, I believe.
Okay, you know what? We should have had on this show a marriage counselor as well, because I don't know if we can answer all of these questions or your concerns. What do you have to add to that, Dr. Rothenberg?
It's like everything. Ultimately, it's best to be upfront and honest. even if there's a little pain along the way, probably make things better in the long run.
Yeah.
But I don't know, I'm not the expert on to answer that question. But, but here's on the other side. For women, don't think it's you not turning them on. I mean, anything's possible, but that's not the principal cause.
It could be in some instances, but overall it's not. Is that what you're saying?
Right.
Okay.
Right. So, again, I mentioned before, everything sounds skeptical. There's quite a bit of published medical literature. They all agree greater than 85% of erectile dysfunction is from this corporal veno-occlusive dysfunction. The veins don't close off the valve, right?
My other question about that I had earlier, and I forgot to ask, if that's the case, why are so many young men experiencing ED? And when I say young men, I mean in their 30s and 40s. They're having the same problem with plumbing, and why are they experiencing it so young?
Okay.
Does that have to do with the testosterone levels?
That's good. But also, your introduction, Sharon, you pointed out 40% of 40-year-olds, 70% of 70-year-olds, 30, and so we can use that scale for every age. We can say 30% of 30-year-olds. We can say 20% of 20-year-olds.
Wow. What were you going to say, Dr. Dyson?
I was going to say I've had men as young as 23 in my practice that had ED.
Age 23 that had ED?
23 years old.
Okay, what were you finding was the problem, Dr. Dyson? It's testosterone level? Is it a mental or psychological issue, a mixture of both?
Low testosterone.
That was always it.
Yeah,
I've had very young men with low testosterone.
Right, you have to suspect that. Or a rare cause is high prolactin. That's a hormone that shuts off libido and erections.
That's a hormone, you said it shuts off libido and erections. Where does that come from?
Well, from the brain. It's the same hormone that produces milk in nursing mothers, prolactin. But basically, there's a surge of prolactin in men, especially after orgasm. And you can see it as a survival mechanism, biology. Okay, reproduction's over. Now you got to get on with finding food and avoiding predators, etc. And the prolactin shuts off libido. Now, someone has like a tumor in the pituitary that produces prolactin. This is a rare case, but when teaching doctors, I say, you always got to think about this. Could be that type of prolactin-producing tumor, and so the guy could be really young with 0 erections and 0 libido.
Wow. That is so unusual. That is rare, though, right, Dr. Dyson?
That is rare, right. That's rare.
Yeah.
What about men who have surgery for prostate cancer? A lot of them end up with ED.
Well, again, no one really comes out on the other side exactly the same. It's very rare. And the nerves that, are on either side of the prostate that feed into nitric oxide production. So you do the same things. You go through the sequence of events. Now, the PDE5 inhibitors actually may help rehabilitate the erection function somewhat. So you go through the whole thing. Optimize nitric oxide through lifestyle. Consider PDE5 inhibitors. Then there's a few other different types of medicines that we have nowadays. Some melanocortins, the one class is called. If that doesn't work, there's vacuum devices where the penis is in a vacuum and pump it up, and a ring slides down at the base of the penis.
Okay.
Then we'll keep going. Then we have sound wave shock therapy.
Wow.
That's similar to what's used like to break up kidney stones, but in different doses. This can help to rehabilitate the veins. And then we've got some stem cell treatments injected into the penis, which also can help rehabilitate the corpora cavernosa veins so they close better.
And when you talk about stem cells, are you talking about from adipose, or are you talking about platelet-rich plasma, or all of the above? I use live stem cells in my practice, umbilical stem cells, but not for this purpose, only for aesthetics, for hair and for the face. But can you use, well, I know it's not probably FDA approved, but when you're speaking of stem cells, which ones are you speaking of?
Well, the data we have on this now is from autologous from yourself, allogeneic from someone else, autologous stem cells from bone marrow or adipose.
Mm-hmm. And have you used that in your practice, and how successful have you been?
Yeah, I've been trained in stem cell science, but I'm personally not using this in my practice. But I'm referring patients to some colleagues who are doing this mixed with the say bone marrow derived stem cells plus platelet rich plasma with good with 50% plus results.
That's
and there's a few
excellent.
papers on
That
this.
is good. Dr. Rothenberg, I was going to ask you, do you address erectile dysfunction in your book at all?
Oh, sure. There's a whole chapter on it, going into much more detail of the things I mentioned, with the references from current medical journals.
Okay. All
And
right.
so the book is good for physicians, health providers, and for patients. And patients might want to purchase the book and maybe look through it and reference it for their physician if their physician is not knowledgeable.
That's a good idea. Dr. Rothenberg,
Exactly.
tell us your book again and where our listeners can find your book.
Hormonal bioidentity.
And they can find it?
That kind of means that everyone's got their own hormone picture. One size doesn't fit all. You can get it on Amazon.
Okay. All right.
Yeah.
All right. And Dr. Dyson, your book too, again?
My book is How to Be Healthy Is Not What You Think,
And it's coming soon.
within a week or two.
We are waiting, yes. I want to thank both of you for being on the show. This has been very interesting information. Thankfully, this is Sirius XM radio, so we can pretty much say whatever we want, and we definitely did that today, right?
Sure.
I hope, though, that what we did was educate folks out there on what it is that they can do. It seems like there are lots of options that men have today that will address erectile dysfunction. So that's it for now, folks. I'm your host, Sharon Morton, and I hope that you take the information we provided today and use it to grow your health. You can hear this show again on Apple and Google Podcasts, Spotify, and Stitcher, and go to mortonmediatv.com if you're interested in being a guest on the show. Thanks again so much for tuning in on all things that are skin deep.